Good morning, one and all. My name is Shanti. I'm a women's health physiotherapist. I come here to just speak a few words on women in badminton. Okay, let me just present before you a small scenario. We have a 15-year-old badminton player, a girl. She's a district badminton champion. She's complaining of her left knee pain for the past 3 weeks. Her height is 5 feet 6 inches. She weighs 50 kgs. Her BMI is 18. When I ask her about her monthly menses periods, she says she's not very sure when she got it last. And then she says she doesn't get it every month. When I speak to her mother says her performance has decreased in the past 6 months. While we're just thinking about the causes, why this girl has not been performing very well, let me just move on to a triad of symptoms called as the female athlete triad. What is this female athlete triad? There are 3 symptoms that this athlete or player will present with this when she has this female athlete triad. The first one is her menstrual disturbance. Sometimes lack of menstrual periods completely. Medically we call it amenorrhea. Second is her energy deficit, which we also call as disordered eating, which I will explain later. The third one is a bone loss. What are the signs and symptoms we need to look at? First one is her periods will be either absent or irregular. Second one, she dehydrates very fast. She'll be prone to overuse injuries. She'll present with a significant weight loss over a period of time. She could also have muscle cramps, weakness, or fatigue. Sometimes when we speak to her coach and when we speak to the parents, the mother especially, she would probably complain of anxiety, maybe the daughter's depressed. The player also sometimes claims that she's very fat, but actually she'll be very thin. She will overdo her exercise. She may be unfocused, she'll have difficulty in concentrating. Also, she may be in the habit of using laxatives and diet pills. This is really a big problem for this badminton player. Okay. Evidence says that in 100 female athletes, 78% of them, so it's 78 out of 100, they'll be normal, no symptoms. 20% of them, that is 1 in 5, will have any one of the symptoms. And 2%, 2 out of the 100, will have all 3 symptoms in this athlete triad. Okay, let me just go on to the first symptom, which is the energy deficit. What is this energy deficit that I'm talking about? See, when the player takes in food, she takes it in the form of calories. And when she works out, when she does her regular activities, when she moves around, she's burning these calories. And what happens? So the calories that you take in minus the calories that you burn out should actually give you a leftover energy. Now what happens if this leftover energy runs in a negative balance? That means she doesn't have any energy. So this is what we call as an energy deficit. Okay. Why does this energy deficit happen? That's why we call it as a disordered eating. What is this disordered eating? Anything that the player goes through from a simple dieting process all the way till clinical eating disorders for which she has to meet a doctor is known as disordered eating. Even if she's just saying, I'm just dieting. Also, we need to check if she has a disordered eating. What are these clinical eating disorders? Anorexia nervosa and bulimia nervosa. Anorexia is these type of girls, these kind of women, they just try to avoid food. And in case they eat, and in case they just indulge, what we call as binge eating, they overeat, then what they do is they try to cleanse themselves, purge themselves. So what they do, they induce vomiting. They put their finger into their mouth and they induce vomiting. Otherwise, they go in for some laxatives, pills, all these things to bring out the food that has gone in before it gets digested. Sometimes what they do could be directly related or indirectly related to the sport that she's particularly playing. Okay, suppose your player has a disordered eating. Now what do you do? Suppose she's going through this eating pattern because she's by mistake, because she doesn't understand how much of nutrients has to go into her body and how much of calories that she really has to take in, then what do you do? At a time like this, we need to educate her. She needs to meet a proper nutritionist. We have to educate her and we have to tell her, see, this is what you need. Please take in this much. Then we monitor her and then she improves. Now what happens to a player who willfully restricts herself? She knows everything. She knows how much of nutrients she needs. She knows what the calories she needs to take in. What do you do for a player like this? But she's just forcing herself not to eat. She's thinking that she's too fat. She just wants to maintain her body for the sake of the game. What do you do with a player like this? A player like this needs a good counseling session. She needs a proper team around her to help her, to work with her, and to get out of this problem. The second symptom in this female athlete triad is your menstrual disturbances or your lack of menstrual periods. Okay, why do these menstrual problems happen? When the player takes in reduced number of calories, the pituitary and the hypothalamus in the brain, they stop secreting hormones. When these hormones are reduced, signal to your ovary is also reduced. The ovaries are the ones that produce your estrogen and progesterone hormone. So the signal to the ovary is reduced. When estrogen and progesterone are not secreted, your regular menstrual cycle does not happen. So the player does not get her regular monthly periods. Okay. This is probably the first problem that the player will identify. Player will identify, her mother will also identify that, okay, the girl is having a problem. Not having your menses is not normal. Once you identify this for 3 consecutive months, she has to see her doctor. Now the third symptom is your bone loss. What are the determinants of the bone density? 60 to 80% of bone density is determined by your genetic factor. Also it's determined by your exercise, physical activity, hormone levels, nutrition, and substance abuse like smoking, drugs, and alcohol. Your peak bone mass for a girl, a peak bone mass is attained between the ages of 18 to 25 years. After 25 years, women lose 0.3 to 0.5% of bone mass per year. Also, if a girl does not have her regular menstrual periods, she loses 2% of her bone mineral density every year when compared to an athlete or a player with normal menstrual cycles. This loss of BMD may not be reversible. Also, this particular player is at 2 to 4 times greater risk for a stress fracture. Okay, so now coming on to screening and diagnosis, we need to screen this player. A good history, from the medical point of view, we need to take a good history, her medical history, surgical history, use of drugs, everything has to be assessed. A proper nutritional assessment has to be done. A good exercise history has to be taken about her workouts, her activities in between her workouts, all has to be done. She needs a good team around her consisting of a sports medicine physician, sports physio, sports psychologist, a nutritionist. Her family and her coach play a very, very important role to help girls to come out of this problem. Okay, in brief, treatment. Any acute orthopedic and medical problems have to be addressed. A good counseling session has to be arranged. Rehabilitation has to be done. Certain lifestyle modifications may have to be prescribed. We need to restore her energy deficit. A weight gain of about 1 to 2.5 kgs is recommended over a period of 6 weeks, and a 10% decrease in her exercise duration or intensity is required. I'm just moving on to another very important aspect. When a female player has her periods, what does she do? Is she advised to play or not to play? Okay. Just breaking some menstrual myths, world's best performances have been recorded at all stages of the menstrual cycle. A lot of studies have said that women who are undergoing their periods have won games as well as marathons. Medicines are available to alter cycle. If it is just for a particular game, they can go in for medicines and alter cycles if necessary by the advice of their doctor. Other myths: girls are considered physically less capable than boys. Certainly it's proved wrong. Sports interferes with studies. We all know that it's not right. Badminton is not a career option. Certainly it's proved wrong. The importance of coaches and parents. Coaches are very, very important to prevent this female athlete triad. Coaches need to be educated. When they are educated on this, they reduce the risk. They can educate their player. They can enhance performance. Also, they can focus on the weight of, without focus on the weight of the player, they can enhance the performance of their player. Okay, I go back to the case, the scenario that I first told you. Now that girl has been told that she's too thin. She's seen her gynecologist for irregular periods. She denies any abnormal eating behaviors. Counseling and education has been done. She's contacted her physician. Physiotherapy for iliotibial band syndrome has been done. She's gained 2.5 kgs at an 8-week follow-up that we have done. The take-home message that I leave with you is, recognize the player's problem and treat it. Girls are equally capable. Badminton does not affect your studies. Badminton is an interesting career option for girls, and it's very, very important that the family and the coach play a vital role in helping girl players to come out of any problem that they face. Thank you.